Chronic lymphocytic leukemia is the most common type of leukemia in the United States. Chronic lymphocytic leukemia affects the lymphoid stem cells that can be found in your bone marrow as well as your lymph nodes. Chronic lymphocytic leukemia, you may have no symptoms or you may have symptoms. Sometimes the only presenting symptom can be an elevated white blood cell in your blood report, and typically your lymphocytic cells in your white blood cell would be elevated in certain types of chronic lymphocytic leukemia. One common presenting symptom of chronic lymphocytic leukemia is enlarged lymph nodes. But any leukemia can involve your immune system, so you may be at more risk of obtaining infections, and also your ability to fight infection may be impaired. You may have fever, chills, or unintended weight loss. One other presenting symptom of chronic lymphocytic leukemia is that it can involve the spleen. If your spleen is enlarged, then your abdomen may feel more full. Chronic lymphocytic leukemia is not always treated. You may not need treatment, but just observation. Reason for treatment would be if you have decrease in some of your blood counts, such as hemoglobin or platelets, or your lymph nodes are really enlarged, then that requires treatment. Until recently, chemotherapy used to be how chronic lymphocytic leukemia has been treated, but there are drugs that are more targeted towards the CLL, and you may not require conventional chemotherapy, but more targeted therapy. We also have many clinical studies where many novel therapies are being tested that may actually be very promising for treatment of chronic lymphocytic leukemia. Of course, having a diagnosis of leukemia is not easy, but chronic lymphocytic leukemia is a disease where you may live very long time without treatment, and even if you do need treatment is improving every day for this type of leukemia. And patients may have an extended lifespan, much longer than what they had previously because of the new developments in treatment of chronic lymphocytic.